Good morning. Thank you for joining us for this workshop on an introduction to rapid qualitative analysis. My name is Grace Ryan. I'm an assistant professor in the Division of Preventive and Behavioral Medicine in the Department of Population and Quantitative Health Sciences, and I'm joined by Melissa Goulding, who will co-present with me. She is a postdoctoral fellow in our department, and we are both members of the Prevention Research Center at UMass Chan Medical School.
So I'll give a brief overview of what we're going to cover. So Melissa is going to give a sort of background of rapid qualitative analysis and some thoughts on when it's appropriate or not appropriate to use it for a project. I'm going to give a pretty thorough overview, or as thorough as I can, in about half an hour of the steps of doing a rapid qualitative project. We're each going to share some applied examples and lessons that we've learned over the last 2 years of doing this work, some resources that we've put together to help you set out to do this on your own, and we should have time for questions and answers at the end of this. So we wanted to just get a sense of everybody who's here, what your familiarity with qualitative research is. So this is just qualitative research in general, not rapid methods. So whether you are very familiar with it and this is something you do regularly somewhat, or have maybe never done qualitative research before. So we'll let answers come in. We're seeing a good mix, maybe leaning towards people who are somewhat familiar. And Melissa will talk about this a little bit more, but this is great. I think one of the things that we love about this method is that it's very accessible to people who have very little experience with qualitative research. So it's a great way to dive in if you haven't done this before. Okay.
All right, so I will take over and get started with a little bit about just some background on what is rapid qualitative analysis. So rapid qualitative analysis is a type of qualitative analysis which is quick and efficient. The goal of this method is to translate qualitative data into actionable results. So in general, I like to think about qualitative methods sort of as a funnel. So you'll have notes, participant information, pages and pages of transcripts. And what you're trying to do is distill this all down using qualitative methods. But then specifically with the rapid methods, you're trying to distill this all down into something specifically that's actionable. So rapid qualitative methods can overcome common issues with traditional qualitative methods, in that they're usually too slow, or they can be too slow to produce results that are actionable. So often with qualitative work, we're trying to understand context, but context can change. And so sometimes with traditional methods, by the time you understand the context has already changed. So these rapid methods are really designed to help and overcome this. In thinking about why you might want to use rapid qualitative methods, as I said, these methods can save time. Because they save time, they minimize costs. And really what they do is they improve the efficiency of the analysis team. So they're designed to be used by teams, and especially by teams with varying levels of qualitative experience. So this makes them a really great introduction to qualitative research for students, trainees, and community members. This part, especially with the community members, is great. We recently just had a training with PRC community members where we taught them rapid qualitative methods, and they're actually currently using these methods to conduct the Worcester Community Food Assessment. And then along the same lines, these methods are best used when they're conducted by people who are familiar with the topic being studied. And again, this really highlights how these are great methods to use with community members who are integrated in the context that you're trying to study. And then because of this ability to work with community partners and also to respond quickly and actionably to community needs, these methods can help promote health equity. So when comparing rapid methods to traditional qualitative methods, studies have found a high level of concordance between the two. The study that's cited here found about 80% overlap between rapid findings and traditional thematic findings. These methods have become more widespread, especially within the implementation field. And then as you can see here from this picture, it's just a quick little screenshot of a PubMed search where we looked at rapid qualitative analysis. And you can see that these methods are being published really a lot recently. And then it's important to note that doing rapid qualitative analysis doesn't preclude you from going back and looking at the data with more traditional analysis. So coding, thematic analysis, content analysis, you can also do all of that after you've used these rapid methods. So it really isn't one or the other, you can do both. So while these methods are great, they're not always suitable. So before getting started, you'll want to assess how these methods align with your study question and with your study design. So rapid methods are best used with semi-structured data. They're not great for unstructured data. They're best when used with an existing theory or framework. They're not great for generating theories and frameworks. And then, of course, before you use these methods, you'll want to assess if there's a time constraint on your project or a reason that makes it necessary for you to be rapid in your methods. So some situations where being rapid would be appropriate are if there are multiple waves of data collection, if you're trying to adapt an intervention, or as I mentioned earlier, if there are contextual reasons that are changing that require a rapid response. So if you do think that rapid approach is well suited for your study, you'll want to consider ahead of time some things. These include things such as how the data will be collected, if you're doing focus groups, interviews, how you'll do transcription. So the rapid methods don't require transcription. Our team always uses it, but again, it's not required. And then you'll also want to consider putting together your team. So you want to think about who's on your team, what parts of the data collection and analysis they'll be involved in. And then also, because there are so many moving parts and because this method relies so heavily on teamwork, you'll want somebody as a point person to coordinate all these different moving pieces while you go through the analysis. And now I'm going to go ahead and hand it over to Grace, who's going to dive more into the methods.
So we are going to talk about the template analysis process. There are, if you do more reading about rapid qualitative research, there are other sort of methods that you can use. We're focusing though on template analysis today. And we are going to present the steps that have been outlined previously. There is a researcher, Allison Hamilton, who's done a lot of work on this, and we have sort of taken the approach that she's used. And we have now done this for several projects. So my goal is to share an overview of this process, go a little bit in depth on each of these steps, and hopefully share some of our sort of best practices and lessons learned along the way, so that you can feel maybe ready to start a project like this yourself. So the first step is creating what we call a neutral domain name that maps to each of your interview or focus group guide questions. These domains are really the heart of how you're organizing your qualitative data going forward. So this initial step is really important. Basically, what we do is take the existing interview or focus group guide that you have, and for each question, create these neutral domain names. You can think of this domain name as sort of a brief summary of the question itself. So I've given some examples on the left. Most of the examples that I'm citing are from the work that we did during COVID-19 vaccination on vaccine promotion and addressing vaccine hesitancy. So for example, this first question, to get started, can you tell me a little bit about your process for COVID-19 vaccine delivery? And we call this domain name vaccine process. Second example, have you experienced any challenges in being able to offer the COVID-19 vaccine to adolescents? And we call this domain vaccine delivery challenges. Because these domains are what you're using to, and as we talk through this process, this will become a little more clear, are using to organize your data. We find it helpful to have a couple of team members do this first. So a couple of team members take that interview or focus group guide, create these domain names, and then maybe compare to see what you came up with. You want these domain names to be very recognizable to whoever is doing the analysis, to be able to map the data into the domain. If it's appropriate, you might want to have domains and subdomains depending on the questions. So for example, if you have a question about pros and cons or barriers and facilitators, you might end up splitting that into, a pro domain and a con domain, or a barrier subdomain and a facilitator subdomain. This is really, and I think this is sort of a theme throughout, you want to create this initial process of the domains, and we'll talk about the template itself. You want to create this so it's responsive to your project's goals and needs, and whatever that might be, if you're doing evaluation, if you're doing intervention, adaptation. So really think about that as you are starting to create these domain names from your interview guide. Our other suggestion here is that if you are using an interview or focus group guide that is based on an existing theory or framework, which a lot of times we are, you might consider using the names of the constructs from that theory or framework as your domain names, just again, make them a lot more recognizable as you're looking through your data and following steps. So once you've created the domain names, you're going to get into creating the actual template that you will use for summarizing data. So I've given an example again from some of our COVID-19 work of the template that we used on the left-hand side. And this template is how you're going to sort of transfer the data from your transcripts or from listening to your recordings and put it into a format that you can use for analysis and synthesis. So as a best practice, we always sort of take the top half of the template and include sort of maybe meta information about the data collection itself and who was involved in it. I always like to include sort of an audit trail this way by saying who prepared the template, who the interviewer was, what the interviewer date was. Again, depending on your project goals and who's involved in your team, you might have other types of information up here. It might be helpful to include, for example, here we had the role of the respondent. In this project, we interviewed both providers and individuals who worked in clinic management or clinic administration. And so we included that as well. Some other things that might be useful here are if you did focus groups, for example, you might want to include the number of focus group participants. If you did data collection in multiple languages, you might include what language the data collection occurred in. Again, any information that you think would be helpful to sort of have collected in this way and sort of collected to give context to the summary itself is important to include here. And this will be sort of dependent on what your type of data collection was and what your goals are. In terms of the sort of template on the bottom half, again, you can see these are the domains that we created from our interview guide. The layout for this is maybe more of a personal preference. I always create a little table in Microsoft Word to do this. I find this an easier way to visualize data and to fill this out. And I find this an easier way to then when we're combining across data collections to look at data. But I have also seen people set this up as sort of a bullet pointed outline where the domains are the main bullets, and then you'll sort of fill in your notes as the sub bullets. So I always set it up this way where I have sort of a 2-column table. The first column is the domains and the second column I leave blank, and that's where we'll fill in our notes and important quotations. I also wanted to note, I think one of a very important thing is to always include not just the domains that you've pre-specified from your interview or focus group guide that map to the questions, but also include this other observations domain. And this is a place where you can capture things that sort of maybe don't map easily to these other domains that you've pre-specified, but as information that you want to capture. I almost always find that in interviews or focus groups, you have somebody say something that's, really fascinating, but doesn't necessarily, it wasn't captured in one of your original questions. I always end interviews by asking, is there anything else that you want to share on this topic that we haven't covered yet? And often this other observations domain is a great way to make sure that you're capturing all of the information that came out of a specific data collection. So once you've created this template, it is time to do sort of a test drive of the template to make sure that it's usable and relevant to your project goals, and then go through a revision process as needed. We have found it to be best practice to have at least 2 team members test out this template using the same data. So basically, we'll take the draft of our template and we will take a specific transcript from our data collection and send it out to the team members who are doing analysis and ask them to fill out that template using that same data so that we can then go through a comparison process. So in addition to summarizing the data, which on the next slide I'll talk through sort of what should be going into the template and how we're using it. So in addition to doing that in this sort of initial round of summarizing process, we want everybody to be assessing the following. This is a great chance to double check, do those domain names make sense to everybody? Do you need to relabel any of them? Would it be useful to split any of the domains into subdomains in terms of data management? Is there any additional information that you want to capture at the top of the template that you hadn't thought about originally? And also take note of how long it takes everybody to do this summarizing process. I think these steps are very important, especially when you're working on teams where you have people with varying levels of qualitative experience and varying levels of research experience. When you're working with community members, knowing, how long it's going to take everybody and sort of making sure you're all on the same page here will help to prevent a lot of headaches sort of further down the line. So in terms of what goes in the template, this is obviously sort of the heart of what you're doing here, right? Is you want to take, like Melissa had that sort of funnel example in her first slide. This is where we're funneling down our data from our transcripts, our notes, and getting it into a really short distilled summary. So because we've gone through this process of mapping our interview guide or focus group guide questions to a domain, essentially what you want to do is take that respondent's answers to each question and distill it into a very short summary so that you have some major points that you're putting in the template within each of these domains. I tend to do bullet points for this. You can use full text sentences for this. Again, sort of a personal preference, but the goal here is, and this is where I think rapid analysis truly diverges from traditional approaches. We are not simply copying and pasting quotes and sort of chunks of text from a transcript into the template. We're really going through sort of this initial process of distilling this information down into the short summary. I also like to include a lot of good quotes in here. Your team's definition of good quotes is going to differ based on your goals for the project, but I think everybody, if you've done qualitative research, you know that sometimes you just get a quote where that person has captured the essence of something better than you could ever write. And so I sort of like to think about it as, what would be a great quote to illustrate sort of this point to a reader or to somebody when we're presenting it. Again, the goal is not just to copy and paste every single quote that you think is good, but to really, because our goal is this short summary, really keep these to short quotes that really bring the context to life. Some other things to include in this template beyond this sort of short summary of responses within domains is things like if you did focus groups, this would be a good place to note what the level of agreement or disagreement was between focus group members. You might have, in addition to your short distilled summary of respondents' answers, you might also have a bullet point in that domain that said most participants agreed on this, a minority of participants, disagreed and said something else. Depending on your approach to qualitative work, you might include counts in a focus group. There's differing comfort and sort of approaches to sort of quantifying qualitative data. I tend to use things like most people said this, some people said this, other people will provide the numbers for that. Again, sort of a personal preference and your approach to this work. It's also good to note in these templates an absence of data. So for example, I'm doing a project this summer and we're using rapid analysis to process our interviews. And we had one question where I think we asked essentially something along the lines of, do you have any suggestions for improvements to this program? And most people said, I really can't think of anything. And so rather than saying, leaving that domain blank, we've noted, participant had no ideas or participant had no response to this, so that we were able to capture that. A good rule of thumb, and this is truly guidance, not specifics of what has to happen, is that these summaries will probably end up being between 1 to 2 pages for about a 30 to 45 minute interview, and maybe about 2 to 4 pages for an hour-long focus group. Again, this will be highly dependent, one, on probably how you organize it. If you use a table versus a bullet pointed outline, it's going to look a little bit different. But I think I wanted to include this not so much to provide hard and fast rules, but to show we really want to distill this down into a sort of the quick and dirty summary of what was in that transcript or what was in that recording. So again, this will differ. I did our one project that I did with this, we did about 10 to 15 minute interviews, and I think that our summaries were around a page for them. So you'll sort of see with your interviews and focus groups what your data looks like and how much you are including in this summary. But mostly just to say this document will not end up being just the same length as your transcript. It's not just your transcript in a different format. So we are still on this sort of step of initial round of summarizing. So remember, we have ideally had 2+ team members do this and sort of take one transcript or one recording and fill out this summary. And now the goal is to sort of come back together and reconcile how similar or different your summaries were. I like to do this by creating a document, and this is one of the reasons I like to use the tables in those templates. I like to create a document where I take each team member's sort of the data that they've summarized by domain and create a table where I have the domains as the rows and the columns are each team member's summary, so we can really easily look across team members to see how similar we are. So I will usually create that document or have your project leader create that document and send it out to the group and then plan a time to meet where the goal of that meeting is really to establish your consistency in the breadth and depth of information that you capture within those summaries. Some other topics that you're going to want to discuss beyond sort of that similarity and how in depth you went into summarizing within the domains is how similar the quotes were that you identified, the level of like the number of quotes that you identified. Does it feel like all team members are on the same page about what constitutes a good quote? And this can be a discussion, sort of as related to the goals of your project and how much you want to include quotes and how what level of data you want to have in these summaries. This is also your chance to make any changes to the content or layout of the template itself. Something that I think Melissa and I learned and that we'll talk about a little bit is doing this process up front can save you a lot of time later if you decide that you need to go in and add something. So really thinking through those questions that I sort of had on the first slide of this step 3 process of, do the domains make sense? Do you need to add subdomains? Do you need to capture anything else at the top of your template? Think about this now so that you can make those changes. And then depending on how this conversation goes, there may be a need to do a second round of this group summarizing. Especially, I think that this would be useful to you if you have made significant changes to your template or particularly if you have team members who have very varying levels of qualitative experience, and maybe some people tended more towards very brief summaries of a domain, and some people were more verbose. You want to sort of get everybody on the same page. And so doing a second round of this group summarizing where you pick a second transcript or recording and go through this process again can be really helpful. We've also done projects that have been very straightforward, and we've done this initial round. We've said, our summaries look almost identical. We feel comfortable moving on from here. But it's really important to have this meeting, even if it is a brief one, just to make sure that everybody is on the same page. And I think especially so if you have a larger team who is doing this and a team with mixed levels of experience with qualitative research that sort of bridges multiple departments or multiple types of organizations. But once you've established this consensus among the team, you can move into step 4 and divide whatever the remaining focus group recordings or transcripts. Again, like Melissa said, there is not a requirement with rapid qualitative analysis to have transcripts. If you just have recordings, you can divide those between your team members and complete the rest of the summaries. So in general, you only really, especially if you've gone through this sort of group consensus process, you really only need to have one summary per focus group or interview. And this is, part of the, another thing that I'll say is dependent on your project goals and what the makeup of your team is. For example, the project that Melissa referenced earlier with the Worcester Community Food Assessments, it's a community partner taking the lead and the Prevention Research Center is supporting them. And they are choosing to have one community partner do the summarizing process for each focus group and have one sort of research team member do the summarizing process for each focus group. I don't know whether they're going to do that through the whole project or that's just to get started, but an example of how you might adapt this for your own goals. Also, like traditional methods, this analysis process can be done in conjunction with data collection or afterwards. I tend to try to do it in conjunction with data collection. I'll sort of talk about why that is in a minute, but this might depend on whether your team has the time capacity to do both at the same time, or if you need to sort of get through data collection and then move into analysis afterwards. I find it to be easier to do them simultaneously because I like to have the person who did the data collection also then fill out the template. Again, you still have to sort of, you still want to do that sort of first round of, group consensus building on this, but once you've done that, having whoever did the focus group or the interview, or if you had a note taker for the focus group, having them fill out the template while this is fresh in their mind, I think is really, really helpful. Especially if you are not choosing to use transcripts for this process and you are working off of a recording and the notes that you've taken during data collection, doing it right at the same time is really great. Either way, I think it's best practice to, as with all qualitative work, to really become deeply familiar with the data that they're trying to summarize. So whether that's reading through the full transcript or listening to the recording before beginning to fill out that template can really help with streamlining this process. And I would say that this is absolutely necessary if the team member who's doing that summarizing or analysis was not involved in the data collection at all. And once you've completed, your team has completed all the summaries, you can move to step 5, which is transferring those summaries into what we call a matrix. So this is basically just a big table where we look at the columns as the domains and each of the individual data collections as the rows. This is, again, our example from our COVID-19 work. I use Microsoft Excel to do this, but you can use Word, Google Docs, whatever you're most comfortable with. And I'll say this is, as Melissa noted, these projects can sometimes be cost saving for teams. And part of this is that you don't need to use a traditional qualitative research software. They do now have much better options. Deduce is much cheaper than some of the other traditional ones, but this can certainly be a cost saving measure here. So basically you create this matrix, which is, you take the domains in your interviews and you can just copy and paste from each of those individual templates into this overall matrix. So you copy, for interview 1, this is what the summary was for the process domain. For interview 1, this is the summary is for the challenges domain. This is a great time to make sure that your formatting is consistent across this. Just for ease of sort of the next step of synthesis and sort of, visually looking through all this data and reading through it, I like to, little things, but sort of data management, make sure that if you're using bullets or sort of dashes for bullets, that's all the same. If you're using sentences, that things are spaced out correctly. It just makes it a little bit easier visually to process all of this. Another thing that we have done in the past is use color coding within this table if we want to highlight a particular feature. So, for example, we did focus groups in both English and Spanish, and so we highlighted the rows that corresponded to the focus groups that we conducted in Spanish in a different color, so that when we were doing comparisons, we could really visually very easily pull that out. And then I'll note, I personally like to make this big matrix in an Excel document and have this be sort of the first sheet of the Excel document. And then I break it down into smaller tables. So I'll just take out, for example, for this one, I think I put the process and challenges domains together and put that on a separate sheet, the receptivity domains and put that on a third sheet, and then the barriers and facilitators and put that on a fourth sheet. So I basically created sort of mini versions of this matrix, and I find that to be a lot easier of a way to look at this data. You might have domains, that just sort of make sense to look at together that you want to do the comparisons for. But this is basically it for sort of the, start to finish, getting from taking your transcripts or recordings and getting it into a format that is usable for the next step of synthesis. And I included an asterisk here just because this is not part of the sort of original process that is laid out if you look at the, sort of Allison Hamilton's papers on this. But given that we have sort of varying levels of qualitative experience, I did want to spend a few minutes talking about how you get from that matrix, which is sort of what the last step in the rapid qualitative template process is, to turning this into actionable information. So this synthesis step will really depend on what the goals of your project are and how you might present your data. A good thing to think about here is, are you going to have textual summaries? Are you writing a manuscript? Do you need to create a figure? Are you putting together a table that will have representative quotes in it by domain? These are all things to sort of think about through this synthesis process. Our team has usually done this by having that matrix and then sending it out to all of the team members who are going to be involved in the synthesis or the writing process, or community members who are part of the project who want to be involved in this process. So we'll take that big matrix and send it out to everybody for review, and then ideally come back together for sort of an in-depth discussion where everybody can give input. And the things that you're going to want to look at here are really getting a sense of variation, both within and across domains. So how similar were participants' responses when you can sort of go down that column within the domain? Did most participants agree with each other? Was there a lot of disagreement? If you have, for example, a barriers domain, are you seeing the same barriers pop up? Are you seeing many, many, many different barriers pop up across all of those interviews or focus groups? So then you can sort of create a mini summary of that. You also want to assess gaps. I think we often come into, research with some ideas of what we might find, and this is a good chance to sort of look across these interviews and think, is there anything that didn't come up that I expected to come up? Did one person bring something up? And then you can usually sort of look across and say, oh, that's interesting. That really didn't come up with somebody else, or somebody said the opposite. What are those gaps that still exist in your data for you? And the matrix allows for very easily summarization, obviously across domains as you're looking down across interviews, but I also wanted to point out, and this is why we use the color coding, you can also use this time to summarize across, for example, if you've done interviews or focus groups with different types of sites or people in different roles, we did them and did some comparisons by language spoken in our focus group. I'm doing a project this summer where we interviewed both academic medical center clinicians and clinicians in community practices. And so we're doing some comparisons by role, and the matrix really facilitates this process because you can so easily look at it. And if you're using Excel, I have, used the sort feature, or, organization to sort of, you can put all of the interviews and sort of summaries by one site, together, and then the other ones at the bottom. So really visually, there's a lot of great ways to look at this. During this meeting, you can also identify important quotations. Again, if you're using, you want to present a table, this is a great time to pull those out of the summaries and start putting them in an additional table. And then also whether you want to identify any sort of count or sort of, majority, minority of participants said this across, this number of interviews. The matrix makes it really easy to sort of look through for that. And so start to finish, I know, we talked through that pretty quickly, but that is really the heart of what doing a rapid qualitative project is. I'm going to share some potential limitations and sort of pitfalls next, but hopefully that gave you a pretty good idea of what this really looks like in practice, and hopefully gave you an idea of how you could integrate this into your own research teams. So before we get into Melissa and I sharing some of our applied examples of this work, I did want to just comment first on addressing some of what I would say that I have seen in literature and sort of in conversations, some of the common maybe critiques of using rapid approaches, and talk about also some of the potential pitfalls that you can find in doing this work yourself. So I would say, especially as I think this method was emerging, one of the concerns, and certainly one that I thought about when I was starting to look at this work is, does rapid mean you're cutting corners? And I would say absolutely no. All of the sort of standards for research and designing a good study still apply. Again, this sort of rapid process is not about the design of the study and the design of the interview guide and how you're recruiting. It's really about a way to manage your data and sort of move into action from your data quicker. So all of the sort of same ethics and standards apply. And, we talk about rigor for qualitative research in a different way than we talk about it for quantitative research. But hopefully, if these are terms that are familiar to you, credibility, transferability, dependability, confirmability, these are ways that we talk about rigor in qualitative research. And hopefully you can see sort of through the process that I've talked about how these can still be present using this rapid approach. For example, in thinking about credibility and sort of that's, how true are your results to the experience of participants? We've actually found rapid methods to be great for doing what we call participant validation exercises. This is where you might hear this referred to as member checking, but basically taking your results that you have synthesized through all of your data collections and then bringing it back to the people that you collected the data from and saying, does this sound right to your experience? Is there anything missing here? Did we capture, sort of your perspectives? And we have found rapid methods to be great for that. We've been able to sort of very quickly create, a 1 to 2 page document summarizing it using that matrix to be able to send back out to community members and get that done very quickly. We also, as with sort of all qualitative projects and certainly with this, and that's part of why I like to keep track of sort of who is doing the interviews, who is doing the analysis, is create that audit trail throughout your work to have that sort of dependability aspect to this. So I'm not going to go too much more into depth, but I did want to just comment on some of these sort of more common critiques of rapid methods and sort of talk about how we have dealt with that and how I know other researchers who do this work have. As Melissa talked about, and hopefully as you sort of saw through how we do the analysis process, again, this work is not best suited for everything. I think particularly, it's probably very clear how it's not well suited for unstructured data. For those of you who are doing, qualitative inquiry where you have very open-ended interview guides where you might not even have an interview guide, and you're doing a more unstructured data collection, it would be very hard to create those domains in the first place, which are sort of the heart of this type of analysis. So again, it's just not perfect for everything, but we have been able to use it a lot. And the two ways that, again, I sort of tried to integrate this into talking through the different steps, but the two places where we have gotten slowed down in the past is certainly by recruitment. Well, the analysis can be very quick. Recruitment is sometimes where we have faced challenges in sort of making this a rapid method. Our approach has always been to try and use embedded researchers or community members to facilitate that recruitment. To help the process go a little bit faster. And then I spoke about this a little bit, but making sure that you sort of put that time in at the beginning to really think about what needs to go in the template and do that process of consensus building with your team to make sure that you're on the same page about the breadth and depth of information the template will prevent you from having to return to your raw data if you need to go back in and add something. And so that sort of wraps up the, talking through the process. Melissa and I are each going to share an example in practice, and then we should still have time for questions at the end. And I see Melissa has been answering questions a bit in the chat as well, so thank you. So I spoke a little bit about how I first started using this to be responsive to some of the emergent needs around COVID-19 vaccination. The prevention research centers were all funded across the country to participate in the Vaccine Confidence Network. And our team had funding to really improve pediatric COVID-19 vaccination. That was our goal. And so we really wanted to create an intervention and program that would support pediatricians having conversations with vaccine hesitant families. And we knew that we were going to do qualitative data collection. We knew we needed to get a lot more sort of nuanced understanding of what was going on, both for pediatric clinicians who were having these conversations with families and also from the perspective of parents. And when we were talking about, designing this study, rapid qualitative methods came up as a way to facilitate very quick very quick action on this. You know, you can see from our timeline, we started doing these focus groups in summer of 2021, which was when the adolescent vaccines had been approved. And we knew that the vaccines for the younger kids were about to be approved. So we're really trying to sort of get ahead of this and be responsive to this, at the time, very emergent need. And I include our timeline. I'm not going to sort of go through all of the steps of this project, but I wanted to include the timeline to really highlight how quickly we were able to move from data collection in July of 2021 to evaluating the intervention that we developed in May of 2022. So in less than a year, we sort of moved through all of this process. And I will note, I have a box on intervention development. Our goal from the beginning was to take evidence-based practice and adapt it to sort of turn into a new intervention for COVID-19. So we didn't sort of start from scratch with this. We really used our interview data to and our synthesis to sort of then identify how this mapped to existing best practices and evidence-based practice and package it into an intervention. And so I'll give an example in the next slide of how we used data from our matrix to identify different components of this intervention that we wanted to have. So this is just one domain taken from our matrix. We had a question for pediatricians around what resources do you need to support you in these conversations and in addressing vaccine hesitancy and vaccine uptake. So you can see this is sort of copy and pasted for our matrix. Each row is an individual interview. And what we did was sort of go through this and see what were the things that were emerging as sort of common needs across interviews. So in green, I have highlighted text across interviews where people, clinicians were talking about the need for more parent-facing materials, some sort of information packet, handouts would be good, having up-to-date fact sheets. So we translated this into updated fact sheets that we made for parents of children ages 5 to 11 to really be responsive to that need for more information for those parents who were considering vaccination for the first time. In yellow, I highlighted, all of the instances where pediatricians said we really need like a training or some sort of presentation to help us be up to date with information, but also to have more training on how to have these conversations. And so we were able to use this, and we created a webinar training and some specific role-playing videos that we were able to present to the clinic that we implemented this with, and sort of have the webinar training be available to them. And so this is really just a very brief overview of how we use these results to develop the intervention, but hopefully it's a good example, one, of what the level of detail in one of these templates might look like, as well as how, at least our team was able to very quickly translate this into something very actionable that we did. And so I'll turn it over to Melissa to share her example now.
Thanks, Grace. So I'm going to go into a second example. This example is from work that we did through the Physical Activity Policy Research and Evaluation Network, or PAPRN, through the PRC. And we did this in partnership with the League of American Bicyclists, so more of like a community partner. The League is a program, or the League has a program called Bicycle Friendly Communities. And this program provides a roadmap for improving conditions for cycling and guidance to help make communities more bikeable. So what happens is communities apply for the program, they're given a score, and then they're given guidance based on their score for areas that they can improve on to improve their bike friendliness and move up in the rankings. So the League recently has focused on improving equity in biking, and as such, they wanted to understand how communities are currently addressing equity in cycling infrastructure, planning, and programming, as well as barriers and facilitators that communities are facing in these efforts. So with the League, this is the example actually that was mixed methods. So we did a survey and then we did focus groups. For the focus groups, we used rapid qualitative analysis. So we held 6 focus groups with the League, and these focus groups were held over the summer of 2022. And so as you can see from the timeline here at the bottom, that thanks to these rapid methods, we were able to really enact action quickly. So the focus group happened over the summer, and by the fall, the changes that were recommended by the communities in the focus groups were already implemented and integrated into the fall application process for the program. So through the focus groups, we identified that equity efforts undertaken by communities were mainly related to community engagement, to infrastructure, and to data. And then we were also able to summarize barriers and potential solutions to these efforts within these content areas as they were reported by the communities. So the communities also specifically asked for resources from the league, and they asked for opportunities to share experiences across the communities. So based on these findings, the actions that were undertaken by the league were to increase feedback and guidance given to the communities related to equity after they had applied. They revised the application process for how equity efforts are captured to better capture the things that we were hearing that communities were currently doing. And then also along the same lines, they revised the scoring related to equity to better capture and give communities credit for the efforts that they were undertaking. And so then the league also, in response to the communities asking for resources, they created a resource library for communities. And then something really cool that came out of this, in my opinion, is the league began offering quarterly network calls. And so this was in part inspired by the focus groups. So communities really loved the chance to talk to each other and share experiences in the focus groups. And in response to how positive of an experience that was, the league started offering quarterly network calls so that the communities could continue to learn from each other in that way. So some lessons learned together from these two examples where we used rapid qualitative methods for intervention development and then also for program refinement. First, we found really that spending time upfront planning with your team, thinking through priorities ahead of time, deciding what is needed can really be helpful. As Grace mentioned earlier, we found through practice that really capturing everything you need ahead of time in the summaries and preventing your team from having to go back to the transcripts saves a ton of time and helps these methods be so rapid. We also found that it's really easy to integrate team members who had almost no previous qualitative research experience, and again, to work with community partners, which is really great and really enriched the work that we did in both of these examples. And then we found that summaries were best completed and completed more efficiently when they were done by people who had collected the data and soon after the data collection had happened. So sort of like Grace had mentioned earlier, when you're really ingrained in the data and the data is fresh in your mind, that's the best time to fill out the summaries. It's when it happens more efficiently and when they're done the most completely. And then importantly, as we saw with these two examples, rapid qualitative methods really produce actionable and publishable results. So in the COVID example, we quickly moved to intervention development, which was critical in the changing context of COVID. We published, I think it's actually 3 papers now that were published from that work and several infographics from it. And then in the cycling example, we were able to implement change into the program pretty immediately with the groups happening in the summer and the change being integrated by that following fall application process. And again, this was very publishable. We had a peer-reviewed manuscript that's actually currently in press, and then there's been several educational presentations based on this as well. So for this last part, before we go into the Q&A, we just wanted to share some resources. So the first resource, this table gives an estimated time commitment for the steps of rapid qualitative analysis. This is really just an estimate and a starting point, and these times will vary. But especially when you're working with community partners, it's important to have kind of this starting point and just a general idea for people to understand how much time they might be committing to the process based on what steps they'll be involved in. So this is a good starting point for that. Next, we have links to a couple videos for more trainings on rapid qualitative analysis. These are both by Allison Hamilton, who's with the VA. And as Grace mentioned earlier, she's really pioneered these methods. So these are 2 other trainings that she's held. Here we have frequently cited publications about rapid qualitative methods. So we cite these a lot in our work when we're describing the methods. And then lastly, we have some of our team's publications for projects that we've used these methods in. So now we're going to transition over to